In today's class, we are going to discuss about one of the most important topic related to gastrointestinal tract, that is antacids. So, before entering into the actual topic, what is acidity? Acidity is nothing but it is an uncomfortable or else it is an unusual situation which is caused because of excessive secretion of acid in the stomach. So why is excessive acid is secreted in the stomach, or what might be the reasons of excessive acid secretion in the stomach? So there are various reasons, but according to ours, it is based on our lifestyle, or else if we don't have food on time, that is our eating habits. If a person is having the habit of smoking or taking alcohol consumption, and if he is having a sedentary lifestyle, these are few of the reasons where acid secretion is increased in the stomach, whereby acidity is caused. So, what is digestion, or how does digestion occurs? We are intaking food, and how does the food is getting breakdown? Once we intake the food in the oral cavity, there is an enzyme called as saliva. So, there are many enzymes which are present in the saliva. So the pH of the saliva usually ranges from 6.5 to 7.5, and saliva contains an enzyme called as amylase. Amylase is the one which is mainly used for breakdown of complex carbohydrates into the simpler carbohydrates. So the food which we intake are highly carbs. For example, like rice and all, what we intake, they are consisting of they are rich in carbohydrates. So these complex carbohydrates are which when intake into the body, because of the action of an enzyme called amylase in the saliva, they get break down into simple carbohydrates. And these simple carbohydrates enter into the body, and in the stomach, the HCl is secreted, and thereby the digestion of food takes place. This is the anatomy of the stomach, and we can see the stomach has three regions: fundus, antrum and pylorus region. And the HCl which is secreted in the stomach, it is secreted by the parietal cells of the stomach. There are various cells like chief cells, mucosal cells, parietal cells, and HCl is secreted by parietal cells in the stomach. And the pH of the HCl ranges from 1.5 to 2. And the molarity of the HCl ranges from 0.3 to 0.003 molar. And the mucus lining which is secreted, the mucosal cells which are present in the stomach, they secrete mucus. So this mucus acts as a lining, or else it is the innermost lining of the stomach, and thereby it protects the stomach lining from acid action. The HCl which is released, it is highly concentrated acid, and which when directly acts onto this wall of the stomach, it may cause ulcers. So that is the reason this mucus layer, it acts as a protective layer, and thereby protecting the stomach from this acid action. Here we can see the various cells which are present in the stomach, the secretory cells. So parietal cells secrete mainly the HCl, and chief cells secrete pepsinogen, which is one of the most important enzyme in the metabolism of various food material which we intake, and mucoidal cells which secrete mucus. Here we can see acid indigestion and heat burn. If the proper, or else the food is not digested proper, or else acid is not getting alkalized proper, what happens? So this condition, this heartburn condition occurs when there is excessive acid secretion in the stomach. So the acid which is secreted in the stomach, it should act on the food. If food is not present in the stomach, or stomach is empty, what does it do, or how does it shows its action? Whether we take food or not, acid shows its action. So that is the reason if we don't take food on time, the acid is released in particular time only. Then in that particular time, the food should be present in the stomach. If food is not present in the stomach at that particular time, then this acid acts in the stomach directly. And if this lifestyle, or else if this habits continue for a regular period of time, then this acid acts on the stomach wall, and thereby day by day the mucus will be degraded, mucus lining of the stomach will be degraded, and there are chances of getting ulcers, peptic ulcers as well as gastric ulcers, duodenal ulcers. There are various ulcers. So if food contents are not present, and if excessive acid is secreted, then what happens in few of the cases, then the acid which is present in the stomach, it regurgitates in the sense it gets back into the oral cavity. So when it enters into the esophagus, that is the region where heart is present. So when it enters into the esophagus, that effect will cause some cause of burning sensation in the heart or else in the chest cavity, whereby there will be very discomfort to the person. And in this, if excessive acid is entering into the esophagus, then there are chances of getting esophagus ulcers also. Here we can see the diagrammatical representation of gastrointestinal reflux or gastroesophageal reflux disorder. Here the gastric contents in the stomach, the blue coloration which is shown in the stomach is acid. Here in the normal stomach, the acid will be about 3/4 of the stomach region. But in GERD condition, that is gastroesophageal reflux disease condition, then the stomach acid will regurgitate into the esophagus as shown in the second picture, and thereby there is a sphincter which is regulating the acid or is regulating the molecule intake from esophagus to stomach. So that pyloric sphincter, even it cannot control the acid which is regurgitating into the esophagus. So that is the region there the acid enters into the esophagus and thereby causing esophagus ulcers. What are the causes of acid indigestion? Why does this happen? So why does the acid is getting back into the oral cavity? So there are various reasons, because first reason can be overeating. If a person eats beyond his capacity, then what happens? We human beings, we get tempted to digestive food. If a person is a foodie, he get tempted to the tasty food. Then if we overeat, then acid or else stomach cannot withdraw or else the stomach cannot withstand the capacity of that food. Then acid, what does it do when it is secreted? It goes, as it is a liquid, it floats beyond the food region, and thereby the acid is entering into the esophagus. And if a person is having alcohol consumption, if a person eats junk food on a regular basis, and if a person is highly anxiety, what does it happens is, like, because of the anxiety, histamine is released. When histamine is released, one of the basic action of histamine is that it induces the parietal cells to secrete HCl. That is, it induces the parietal cells to secrete protons, and thereby the HCl secretion, acid secretion is more, and thereby there occurs various peptic ulcers or GERD kind of diseases or gastric diseases. And if a person is having smoking habits, and the other one is because of few of the drugs like aspirin, antacids, aspirin, NSAIDs. These are few of the drugs that's non-inflammatory, non-steroidal anti-inflammatory drugs. So these are the drugs which, when intaken for a long period of time, they promote the parietal cells to secrete more amount of HCl. Then thereby we can there are more consequences or more chances of getting peptic ulcers. What are antacids? These antacids are the agents or the drugs which neutralize the acid. So these do not cure any peptic ulcer. But the thing is, if any excess of HCl is released into the stomach, then what does they do? They neutralize those acids. They neutralize the protons which are present in the acid, and thereby they reduce the action of HCl. But they do not cure ulcers if formed. What are the drugs come under this category of antacids? There are three forms of drugs. One is aluminium salts, calcium salts, and magnesium salts. In aluminium salts, the majorly used antacid is aluminium hydroxide. There are various other forms also. And in magnesium salts, there are mainly two forms, magnesium hydroxide and magnesium oxide. When magnesium oxide and magnesium hydroxide is used in combination of a formulation which is called as milk of magnesia, this is very effective antacid available in the market. In the calcium salts, the mainly used calcium salt is calcium carbonate. There are various other forms of calcium also available as an antacid, but calcium carbonate is mainly used and it is very effective as an antacid. So there are two types of antacids, systemic antacids and non-systemic antacids. So these systemic antacids act at only particular location in the body. So, but the advantage of the systemic antacids are, they are used for short therapy and they are having rapid onset of action. the main disadvantage of the systemic antacids is like they cannot used for chronic therapy. In case if they are used as a chronic therapy, then they cause overload on the kidneys. If overload on the kidneys is done, then kidney failure may occur. So that is the reason these systemic antacids are used for short-term therapy. And the antacid which is used as systemic antacid is sodium bicarbonate. Non-systemic antacids. Non-systemic antacids are the one which are used for long-term therapy or chronic therapy, but their onset of action is less when compared to systemic antacids, and these are used all over the body. I mean, the action of these non-systemic antacids can be observed all over the body, and even these non-systemic antacids, they do not alter any acid-base imbalance in the kidneys also, and they do not cause any overload in the kidneys. So that is the reason these can be used for chronic period or longer period of time. And the examples which come under this non-systemic antacids are calcium carbonate and aluminium carbonate. What happens if antacid is entering into the body? If we intake an antacid, it undergoes some sort of reactions, because these antacids are nothing but these are salts. These are salts of ions or molecules. So these metal ions or these ionic salts which when enter into the body, they definitely undergo some sort of reactions. They may be neutralization reactions, acidic reactions, or alkaline reactions, or there may be various other reactions these antacids undergo. So these are few of the antacid reactions which when enter into the body, they react with HCl. So the main use of these antacids are to neutralize HCl action. This is done by reacting the antacid with HCl only. For example, if we take calcium carbonate when it is reacting with HCl, it forms calcium chloride, water as well as carbon dioxide. And at the same time, sodium bicarbonate also when it is reacted with HCl, it forms sodium chloride, water and carbon dioxide. This excess carbon dioxide which is generated because of this antacid reaction, it is eliminated through respiration. And the other one is aluminium hydroxide. Aluminium hydroxide, when it is reacting with HCl, then it forms aluminium chloride and water molecule only, because there is no carbon atom available in this aluminium hydroxide, so there is no chance of eliminating or else getting out of carbon dioxide out of this reaction. And the other one is magnesium hydroxide. Magnesium hydroxide, when it is reacting with HCl, then it forms magnesium chloride and water. The other one is magnesium oxide. Magnesium oxide also, it forms magnesium chloride as well as water molecule. So what is the mechanism behind this antacids? How these antacids act? So these antacids act mainly by showing defense mechanism of mucous membrane. So first thing is like they undergo these antacid reactions, they react with HCl, they neutralize the HCl action. Apart from that, they induce the mucus secretion in excessive amount. They induce the mucoidal cells which are present in the stomach to secrete excessive mucus, and they add an adhesion protection act, or else they add an adhesion protective layer for that mucus lining of the stomach, and thereby protecting the stomach from this acid action. These antacids, when they are entering into the stomach, they act by three basic mechanisms. One is they aid the mucus secretion, they help in the mucus to secrete. The rest, they help the mucoidal cells to secrete little more mucus. And the other one is bicarbonate reaction, that is the bicarbonate, it helps buffer acidic properties of HCl. They aid in the excessive release of bicarbonate ions, and thereby these bicarbonate ions react with HCl and thereby it neutralizes the HCl action. The other one is prostaglandins. Prostaglandins are one of the 20 carbon atom eicosanoids which when secreted into the body, they act by inhibiting the HCl reactions because they prevent the action of proton pump. There is a proton pump in the parietal cells. There is a proton pump present. This proton pump aid in the entry of H+ ions into the stomach in excessive amount. So when this proton pump is inhibited, then thereby there occurs decreased HCl secretion into the stomach wall. So that is the reason this prostaglandins play a very important role in antacid digestion, or else in neutralizing the acid which is released in excessive amount. Let us see in detail of this antacids. So aluminium salts. So there are basically two forms of aluminium salts, that is carbonate salts as well as the hydroxide salts. So the mainly used aluminium salts is hydroxide salts. Aluminium hydroxide is used in the form of gel, thereby where it is available in the market. But the disadvantage of these aluminium salts are they are having constipation effect. So which when used in excessive amount, they cause constipation to the patient. So that is the reason it is used in combination with calcium salts, thereby it can come over the constipation effect. And magnesium salts. Magnesium salts are available in carbonate form, hydroxide form, oxide form and trisilicate form. So these magnesium salts, which when taken in excessive amount, they have a side effect of diarrhea. So that is the reason these magnesium salts are given in combination with another salts to antagonize or neutralize this diarrhea effect. So each and every antacid has its own side effect when used individually. But when it is used in combination, then thereby the side effect can be reduced a little when these combination of antacids are used. But these magnesium salts should not be given if a person is suffering from renal failure, because these magnesium salts, they release excessive amount of chloride ions, and these chloride ions, they may cause overload on the kidneys, and thereby if a person is suffering from renal failure, when overload is added to the kidney, and thereby it will worsen the effect. The examples of these magnesium salts include magnesium hydroxide, magnesium oxide, magnesium oxide trisilicate, and there are carbonate salts also. But combination is used with aluminium. Calcium salts. There are many forms of calcium salts which are available, but mainly calcium carbonate is most commonly used and it is most effective antacid. And this calcium salts also have a side effect called as constipation, and that is the reason this calcium salts are used in combination with aluminium to antagonize or else to reduce the side effect of constipation. But here when calcium salts are used for long-term action, then it have increased the gastric acid secretion. So these calcium salts alone should not be used or for longer period of time. On longer therapy of these calcium salts alone, it may cause excessive acid secretion, thereby instead of antagonizing the acid effect or else neutralizing the acid, it may produce synergistic effect. And these calcium salts are even given as a supplement for dietary calcium. If a person is not having, or else if a person cannot take calcium in his food, or else if a person is not getting calcium intake into his body in his diet, then these can be used as a dietary supplement for calcium deficiency patients. Sodium carbonate. Sodium carbonate is one of the antacid, and it is a sodium salt which is highly soluble in water. And this is a very powerful, or else we can say it is a very effective buffer which antagonizes HCl reaction, because sodium has higher affinity. Sodium carries only one molecule, that is one atom, Na+, as well as H+, proton also, and chloride ion, Cl-. These are having only single molecules. If when dissociated, they are having only one ion with them. So that is the reason the sodium has greater affinity to chloride when compared to calcium and magnesium, because calcium has Ca2+. It requires 2 calcium atoms in order for it to get reacted with calcium. But sodium, it just needs only one calcium atom, only one chloride ion to get for it to get reacted. So that is the reason the sodium has very high affinity to calcium. That is why the sodium salts can neutralize, or else they can antagonize the acid effect very faster. They have quick onset of action, but the one disadvantage of the sodium salts are like it causes metabolic alkalosis. As it has high affinity for bonding, at the same time it has high affinity for dissociation also. When it is getting rapidly dissociated, it dissociates chloride as well as carbonate, bicarbonate ions very rapidly. And when these bicarbonate and carbonate ions are secreted into the body, or as they are when this carbonate and bicarbonate are available in larger amounts, thereby it causes metabolic alkalosis. It will make the pH, or else the surrounding pH is converted to alkaline, which is not required. I mean, if a body, a particular region should have acidic pH. Instead of that, bicarbonate ions are secreted in that particular area. Then instead of having acid effect, it may have alkaline effect, where there is of no use with that alkaline effect. So it causes metabolic alkalosis. The other one is sodium content may cause. If sodium dissociation, if the sodium salts are dissociated, then sodium ions are available in huge amount. If the sodium ions are available in huge amount, sodium is one of the major cause of hypertension. If a person is suffering from hypertension or heart failure or any cardiovascular related disorder, if sodium is available in larger amounts, then that disease condition can be worsened. So that is the reason. This is one of the basic or main disadvantage of this sodium salts. That is why they are not marketed well, but if available, then if a person is taking these sodium salts as antacid, he or she should take care that he is not suffering from, or else he don't have any cardiovascular disease history, and before that he should not have high BP or his blood pressure or any cardiovascular disorder. Then only these sodium salts are recommended. The main side effects of these antacids are, as we have discussed in the previous slides only, magnesium have the side effect of diarrhea, aluminum and calcium salts have the side effect of constipation, and these carbonate salts, the salts which are containing carbonate or bicarbonate ions, which when reacted with HCl, they form water as well as carbon dioxide. When this carbon dioxide is generated in excessive amount, it causes bloating and flatulence. Bloating in the sense, the stomach contents will be enlarged because of the gaseous region or gaseous situation which is created. And the other one is, it causes flatulence, that is excessive secretion of gases in the gastric contents. What are the interactions of these? What are the main interactions? If antacid is taken with another drug, then this antacid will bind to that particular drug, and thereby the bioavailability of that particular drug is reduced. If an antacid is binding to, for suppose, a drug called aspirin, then this aspirin availability will be reduced. The amount of aspirin which is present in the systemic circulation will be reduced, and thereby the aspirin which when intake also there will be of no use. And the other one is, it have chemical inactivation. These antacids, if a chemicals act on these antacids, they become inactive, and thereby there is no use of this antacids. The other one is, they increase the stomach and urine pH, which decreases the absorption. So these antacids, what do in some situations, if they are taking for chronic period of time, then what happens is like they increase the H+ ions, they increase the alkaline effect of the stomach contents, and thereby the pH will be increased. The stomach pH will be increased. If stomach pH will be increased, and thereby the absorption as well as excretion of few drugs will be decreased. Because these drugs will be effective in the acidic region. If a region has become alkaline, then these drugs will not be absorbed. And if these drugs will not be absorbed, they can't be excreted properly, and thereby the absorption as well as excretion of certain drugs will be reduced. If a drug is present as such without showing its effect, then the drug starts showing its side effects. If a drug, instead of showing its effective use, shows its side effects, then it may worsen the condition of the patient. What are the other effects? Apart from these interactions and side effects, what are the other effects which are shown by these antacids? So this carbonate ion, what does it do? If it is taken in high doses, as I told you, bicarbonate plays a very important role in the kidney. In the nephron and neuron also, these bicarbonate ions play a major important role in the reabsorption and distribution of the drugs. So that is the reason these bicarbonate ions, if they are secreted in large amounts, it may cause kidney failure, overload on the kidneys, and thereby they show reverse effect. And aluminium hydroxide. This aluminium hydroxide, sometimes it is aluminium hydroxide when it is reacting with phosphate. then it forms complex of aluminium phosphate, and when this complex of aluminium phosphate is formed, then it leads to, or else it leads to a risk factor called as hypophosphatemia and osteomalacia. Hypophosphatemia is a condition where the availability of phosphate is reduced. Phosphate is also required for our body. So when this phosphate is not available, phosphate is present in the body in various forms. For example, ATP. ATP is adenosine triphosphate. Adenosine triphosphate is nothing but the energy giving substance. It is when ATP is synthesized in the body only we get energy. So this phosphate plays a very important role. And this when this phosphate is not available, then it can lead to a condition hypophosphatemia where decreased phosphate will be available, and osteomalacia. Osteomalacia is a condition where bones get softened, they get fragile, and they can be easily breakable. Magnesium hydroxide. Magnesium hydroxide, if it is taken in excessive amount, what does it do? It gets accumulated in the kidney region. These magnesium salts, they get easily accumulated in the kidney region, and thereby it leads to a condition called as hypermagnesemia. And sodium. If sodium is present in excessive amount, we all know it leads to various cardiovascular disorders, especially hypertension. And what are the combinations we can give with antacids? If antacids are given with alginates, then they prevent, these alginates are the substances which they bloat or else they bulge in the gastric contents. These alginates, they are like the substances in the gastric region, they float or else they add little more amount to the gastric contents, and thereby what does it do? It prevents the acid to get reflected or else regurgitated into the esophagus. So that is the reason antacids are recommended mostly with alginates in order to prevent the regurgitation. And antacids are given with anti-foaming agents. So these anti-foaming agents are the substances they prevent the formation of gas, or else if excessive gas is formed, then if these anti-foaming agents are given, these excessive gases can be excreted or eliminated out of the body. And so what are the causes, or else what is the care which we can take while giving these antacids? So while giving these antacids have side effects. So we have to monitor these side effects. A patient may have a few patients have nausea, diarrhea, constipation, vomiting, and in adverse or else in higher situations or else in worsened conditions, the person may suffer from heart failure, hypertension, and various other diseases. So that is the reason these side effects should be monitored when these antacids are taken. But in severe cases, if a person is having severe side effects, then he should be taken to the medical practitioner immediately in order to prevent the death of that person. And so these are antacids, and there are various other drugs also which act on the gastric region. But these antacids, the difference between these acid neutralizing agents or as the acid reducing agents as well as antacids is that antacids, they do not cure peptic ulcers, but the drugs which we are seeing, the category which we are seeing from now, they cure the peptic ulcers, or else we can say anti-ulcer drugs. These are given because these act on the mechanism. The mechanism of these drugs are same. The ultimate motive of these drugs are to reduce the acid secretion. Thereby these drugs, these anti-ulcer drugs, they reduce the acid action. So there are various anti-ulcer drugs. So the anti-ulcer, one of the category of these anti-ulcer drugs are H2 antagonists. Histamine. Histamine is an allergen which when secreted into the body, it aids or else it stimulates the parietal cells to secrete more amount of HCl. So in the parietal cells, these H2 receptors are present. These histamine, it goes and binds to the H2 receptors, and thereby it aids in the release of the histamine. And when histamine is released in large amount, then indirectly the HCl is also released in large amount, and thereby the ulcer formation is caused. These H2 antagonists are the drugs that prevent the histamine to bind to that H2 receptor, and thereby the histamine action cannot be showed or else it can be nullified. So the drugs which are used as an H2 antagonists are cimetidine, famotidine and ranitidine. There are various other H2 antagonist drugs also, but these three drugs are used as anti-ulcer drugs. So what can be the mechanism of action of these these H2 receptor antagonists? We can see the diagrammatical representation here. In the parietal cells, the H2 receptors are present. So the histamine which is released from the mast cells, it goes and binds to the H2 receptors and thereby it can show its action and it aids in the secretion of HCl. These H2 receptor antagonists, they prevent the histamine to bind to that H2 receptor and thereby the action cannot be showed and thereby the acid secretion will be reduced. So what are the uses of these H2 receptor antagonists? These H2 receptor antagonists are mainly used in various diseases like peptic ulcer disorders and gastroesophageal reflux disorders, and they have erosive esophagitis. Erosive esophagitis is a condition where the inflammation of the esophagus takes place, and GERD, that is gastroesophageal reflux disorder, is that because of the regurgitation of gastric contents, the ulcers are formed in the esophagus. And it is used as an adjunct therapy, or else these H2 receptor antagonists are used as a combination therapy for GI bleeding. If there is any internal bleeding in the gastrointestinal tract, these H2 receptor antagonists are given as a combination therapy. The other one is in the gastro-hyposecretory conditions, that is Zollinger's syndrome, Zollinger-Ellison syndrome. It is a syndrome where the gastric secreting tumor is present in the parietal cells, in the islets of Langerhans. So in the pancreas, these islets of Langerhans are present. These islets of Langerhans contain some tumor secreting gastric secreting tumor, and if this gastric secreting tumor secretes excessive amount of HCl apart from the parietal cells, then a condition called as Zollinger-Ellison syndrome takes place. So this Zollinger-Ellison syndrome, these H2 receptor antagonists, they can be used in this particular syndrome. What are the side effects of these H2 receptor antagonists? So the main side effect of cimetidine is, cimetidine has a side effect called as gynecomastia as well as impotence. In males, it can cause impotence as well as gynecomastia. It is a condition where breast development takes place in the males. And it has few side effects, common side effects like headache, lethargy, the person will not be socialized, and he has some confusion. If he is doing particular work also, you have confusion. In few cases it may cause diarrhea, urticaria, blushing and some kind of rash also. Okay. The other one is that proton pump inhibitors. So proton pump inhibitors are the ones. What is proton pump? The proton pump is a pump which is present in the parietal cells where exchange of H+ ions and K+ ions takes place. Here we can see the parietal cells, they secrete, they release positive H+ ions. Apart from HCl, during the HCl secretion, positive H+ ions are secreted out of these parietal cells. So this is called as proton pump. Normally these H2 receptor blockers or other anti-ulcers cannot stop this proton pump, or else they cannot stop this action of this proton pump. So that is the reason proton pump inhibitors are used. For example, the drugs like omeprazole, rabeprazole, lansoprazole, pantoprazole, omeprazole, these are few of the drugs which are used as proton pump inhibitors. So now we can see the mechanism of action in the parietal cells. The one we can see the red coloration, parietal cells. Under the parietal cells there is a binding, there is a molecule called as ATPase. So that is the reason the H+, K+ ATPase pump. So where the exchange of H+ and K+ takes place on utilization of ATP or on utilization of some energy. So these proton pump inhibitors, they act in this particular place and thereby they inhibit the HCl to be secreted out of the parietal cells, and thereby the HCl action can be reduced. Then, what are the uses of these proton pump inhibitors? These proton pump inhibitors are also mainly used in GERD therapy, and they are used in erosive esophagitis, and they are used in Zollinger-Ellison syndrome. They are used in treatment of H. pylori syndrome also. H. pylori is a bacteria, or H. pylori is a virus which causes or else which stimulates the acid secretion. So if H. pylori is present in the body also, it stimulates the parietal cells to secrete excessive HCl. So that is the reason these proton pump inhibitors are used in the treatment of H. pylori. They kill the H. pylori and thereby the HCl secretion can be reduced. And they are used even short-term therapy, or else they are used in short-term treatment of duodenal as well as gastric ulcers also. What are the side effects? So the side effects of these proton pump inhibitors are that common side effects are observed like headache, lethargy, diarrhea, blushing, rashes. These common side effects are however observed. But these proton pump inhibitors should not be used for chronic therapy. If they are used for chronic therapy, they aid in the more H+ ion secretion rather than reducing the HCl effect. So that is the reason these are used for only short period of time. Longer period of time they are not recommended. These are few of the antacids which are available in the market. For example, Alka-Zestor. This is a antacid which is used or is prepared in the combination of sodium bicarbonate as well as potassium bicarbonate. And Andrews antacid, it is a combination of again calcium and magnesium salts. And Equate, it is a combination of aluminium and magnesium. And Malox, it is available in the liquid form, and it is also a combination of aluminium hydroxide. And calcium carbonate is available in the tablet form as a marketed formulation of Malox. Milk of magnesia, it is a combination of again magnesium oxide and magnesium hydroxide, which is a very effective antacid. And Pepto-Bismol is for adults as well as children. It is not for both geriatrics and pediatrics. So in geriatrics, the molecular formula or as the formulated form is different, as well as in children's it is different. So in Pepto-Bismol, it is used, bismuth salts are used, whereas in children the calcium carbonate salts are used. This is about antacids.